I'm Neil Haldar. I'm a consultant urological surgeon, and today we're going to talk a little bit about prostate cancer surgery. So usually for prostate cancer surgery, we remove all of the prostate. And the reason is that prostate cancer tends to be what we call multifocal. So it's rarely just one area of tumor within the prostate. It's usually different areas that are affected by the prostate cancer. So removing just part of the prostate is rarely curative. And so that's why we tend to remove all of the prostate. Whereas for other conditions such as benign enlargement of the prostate, you may have a procedure just to remount parts of the inner part of the prostate to widen the channel to make it easier to pass urine. On average, the surgery for prostate cancer takes about 2 to 3 hours, and that's a radical prostatectomy. Usually half an hour to an hour prior to the surgery, where the anaesthetist is doing giving the anesthetic, and about an hour afterwards in the recovery room before you're ready to go back to the ward. So after surgery, you'll be allowed to eat and drink as normal. You will have, we often put a pelvic drain in at the time of the surgery, because where we've rejoined the bladder to the water pipe, that joint won't be watertight straight away. So the drain allows any urine that leaks through the joint to come out, and any blood from the operation to come out through the drain. Usually, if it's nice and dry, we'll take that drain out after about 24 hours. And then most patients will go home after 24, 48 hours with a catheter. And again, a catheter is used to allow the urine to come, to drain out of the bladder, bypassing the new joint until the joint becomes watertight and heals fully, which normally takes about 10 to 14 days. So the patient returns after 2 weeks to have that catheter removed. So prostate cancer surgery can certainly affect a man's sex life. It has an impact on erectile function due to the fact that the nerves that control the erectile function run alongside the prostate. The effect it has on erectile function depends on a number of factors, including the patient's age, the quality of their erections before surgery, and the extent of surgery required to remove the prostate cancer. But realistically, over 50% of men after prostate cancer surgery will have a lower quality of erections and will likely to require treatment to help them with their erection. The other main side effect from prostate cancer surgery is that of stress urinary incontinence. Because we remove the prostate and rejoin the bladder to the water pipe, that disrupts the sphincter mechanism to the outlet of the bladder, and that takes a little bit of time to heal. So when the catheter is removed after 14 days, most men will be required to wear some incontinence pads, because when they stand up, cough or sneeze or exert themselves, a little bit of a dribble may come through. The majority of men will be able to dispense with those incontinence pads within a few weeks. I would say about 90% within 3 months of surgery have dispensed with the pads and no longer need them. About 5% of men take a little bit longer, and a small proportion of men never completely dry up and may require further procedures to help with that.